So we heard a lot about diabetes type 2, and so what I want to do is give a little overview of diabetes type 2 and its pathology, or its pathophysiology. So diabetes type 2 is kind of a culmination of several different factors that eventually contribute to the end result of diabetes type 2. One of the biggest beginning things that contribute to diabetes type 2 is obesity, the poor diet and the lack of exercise. Additionally, on the other side of things, we have genetic risk factors. That would be like a positive history of diabetes type 2. And both of these kind of snowball into something else. But to start with, we have insulin resistance. We're always kind of at a flux with the hormones in our body. And so the hormone regulations kind of help us keep our blood sugar in check. And one of the notable ones we all hear about is insulin. Insulin basically needs to get inside the cell to create usable energy. And when you can't do that, and the system is being retarded in some way, that's when we develop insulin resistance. Okay, your body basically isn't able to do that, and so your body compensates for that, and it upregulates the production of insulin. So your pancreas is going harder and harder and harder, and that's when we develop something called hyperinsulinemia. Okay, so through time, people can get away with having hyperinsulinemia and have normal glucose tolerance. Okay, but over time, this begins to break down, and we start getting impaired glucose tolerance. And the impaired glucose tolerance is kind of one of the first signs. Let's go the other direction. One of the first indicators of diabetes type 2. And diabetes type 2 has three traits that really kind of characterize the disease. And that's increased hepatic glucose production. And increased hepatic glucose production is basically your liver trying to increase the glucose amount to fuel your muscles and your cells in your body. And your body is telling your system, you're starving me. Okay. After that, we have peripheral insulin resistance, and that's our skeletal muscles. We need to get insulin into our skeletal muscles because we use them on a daily basis all the time in everything that we do. And so when that starts breaking down, your muscle tissue also starts to break down as well, because it takes usable amino acids to actually try to fill those cells. And those cells over time will, start to break down because we're not getting that usable energy in there. And the last one is decreased beta cell function. Like I said, with the hyperinsulinemia, your pancreas is just going and going and going and going, and finally it begins to tire out. And a decrease in beta cell function is observed, and so you're not producing as much insulin. And these are kind of the three traits, I guess, that are saw in diabetes type 2 patients. And so beyond that, we have some scary words that we always hear in Indian country, such as cardiovascular disease, cerebrovascular disease, liver disease, and cancer. And those are some scary words. We hear them all the time. And we hear the data and we see the data, and all these are all on there. All the health disparities of Native Americans. And so it kind of culminates from the diabetes type 2. Okay. So what next? So implementation of a strategy with your healthcare provider. Either a minimum weight gain or a weight loss program is usually one of the best key factors, in addition to a standard of care, including metformin, sponureas, different medications like that. And also your healthcare provider might introduce some management of your comorbidities as well.